So polyp is again sort of a growth in the mucosa of nostril. It can be on either side, it can be on both sides. And this polyp is a growth in nasal mucosa. And because there is a physical growth, that side gets blocked and then congested. Not only that, it is blocked for the air circulation or inhalation, but it is blocked for even the mucus circulation. And then stagnated mucus again leads to same thing, sinusitis and chronic congestion in the whole pansinusitis, what we call. All sinuses get congested. And depends upon the extent of physical growth of polyp, the symptom starts coming. And it's really frustrating because, and it's the funniest part is, we have seen that polyp is a mechanical obstruction. Logically, it's a mechanical obstruction because of the polypoid growth in the mucosa of the nostril. But in that case, we have seen that if you ask the person to just toss about, walk about little bit, and their nasal block goes off. Because body has that phenomena, that potential to accommodate and adjust so that the inhalation comes, the patency comes in both the nostrils, in spite of that polyp being there. Then we have seen even seasonal variation. We have seen some of the people, like if it is a pollen grain season, like say March, that time it grows and the person typically starts getting it, and then it will be there, severe grade of a nasal block for 3-4 months, and again it will ease for 7-8 months.
So when the pollen is gone, then it's
Allergens, if there are no allergens, again the polyp will be peaceful. Structurally it will be there, but functionally it will cease to show the symptoms. So it's a very funny phenomena, and ENT surgeons also are nowadays convinced that even if it is resected, it recurs. It recurs because see, it is not something which is inserted there by someone else. It is body which has created it or which has allowed it to be created. So that tendency you are not dealing with. See, and every growth in our body, wherever it is being maintained. Circulation wise, nerve supply is there, lymphatic drainage is there, mucus is secreted there. So it is being maintained and there is a central note of it. So without the knowledge of your central system, if someone else comes and just resects it out, there naturally there would be some turmoil in the whole system. And again it is created and recurrence is there, and that recurrence, that growth of polyp is more gallopingly occurring than the original one. So therefore even ENT surgeons have realized that the polyps need not be resected, but rather they should be tackled in a different way, so that we have to treat the person who has developed a tendency to form polyps.
yes.
And even now, ENT surgeons, they say that we have to operate, and they convince the patient that because it is emergency, your sinuses will get blocked, you will get so many complications, you will get headache, nose chronic thing has occurred. So we will resect it. Even if it is for 6 months, doesn't matter. We will resect it, we'll remove it. So that at least for 6 months you're all right.
But it comes back.
It comes back. 99% it comes back unless he is internally treated. That's why actually many ENT surgeons have come to conclusion that we can give homeopathy for the treatment of polyps. Give it, if it reverses even 50%, even 50% relief is there should be no issue. So in polyps, even surgeons have realized that we have to treat the whole person internally to remove the tendency of formation of polyp, and once that is treated, then if it doesn't, 99% it should reverse, because body has that phenomena where body realizes that this should not be maintained, then body will definitely stop maintaining it, and then it will reverse. And even 10% regression in size of polyp will give 100% relief functionally. Means the person will start breathing properly. We have seen it. We have seen the polyps being resected, and within few months, the same size, same phenomena has recurred,
Same
and
size even.
same size even. And we have cases here, like where we started treating polyp, it took few years. It took few years, but slowly, the relief comes, and the person doesn't mind getting treatment, because we ask the person to report once in 2 months for the treatment of polyps, and maybe around 10 12 visits, we see that functionally it is like 100% relief, because person starts breathing through nose. There is no nose block, and if you examine, there would be a polyp will be there, but it will be regressed in size, it will be remnant, and maybe if we follow it for 10 years, 15 years, it would recede completely. But what we do is, once we see that we have set the phenomena, that body is absorbing it, it is reversing, and you have functional relief completely without any palliation, then you just go ahead with it, and you don't need further treatment. So once tendency is gone, and already it has regressed 50%, and functionally the person has 100% relief, then there is no point in giving the treatment. In homeopathy, that is the best part, that once the tendency goes, then it will not come back on its own, unless there is a maintaining cause, that person is exposed so much. And see, everywhere, if it is a hypertrophic phenomena in the nasal mucosa or a polyp, there is some element in the system which triggers the defense, and because as a result of this defense getting triggered, these growths occur, this hypertrophy occurs. So it is always, some phenomena in the body which body feels that it is essential to form this, or essential to maintain it, and under that delusion body maintains it. So if this, what therefore we always call in homeopathy, awareness is the health. So here at tissue level, if the awareness is there that only this much of congestion as a temporary measure is required for combating this infection, and now we don't need to maintain this congestion of blood or supply or mucus to this area, and then body recognizes it, becomes aware of it, and that awareness leads to the regression phenomena, it triggers. So even hypothetically also this is possible, and homeopathy has demonstrated that people with a chronic nasal polyp being there for years together, functionally has reversed completely, and structurally also there is relief, and we have seen it. Now it's difficult to say that, like, how the drugs act, but definitely, on the basis of totality, if we give, on the basis of symptom similarity we give, and the person will stop developing this polyp further, and will not allow any complications to occur. We have seen it.
Wonderful. If I could have 5 minutes more of your time, I would like to ask you about problems in the nose. I had the most painful surgery I've ever had, when I wanted to be a singer and there were too many bones blocking my nose. And recently a friend of mine has had the same surgery. Is there any other way?
See, the barrier, what we call a partition in the nostrils, is nasal septum, and this septum, part of it is cartilage. And this septum, we have seen what we call DNS, deviated nasal septum.
That's what I had.
Yes. So this deviated nasal septum is very just logical, that one side, if it is pulling more and the other side is weak, then the partition gets deviated to that. It's like that. So it is mainly because of the allergy phenomena in the mucosa, where there is a congestion, and when because of congestion there is uneven pull, that vacuum of while inhaling, then that deviates. So this deviated nasal septum is again a secondary phenomena completely. So there is no point in making it, straight. They call it SMR. The surgery is SMR, where they just cauterize the growth and make it straight.
And in those days, they couldn't even use
And they,
anesthetic.
yes,
You had to suffer that whole thing.
yes. And have you noticed that when they conduct surgery, they plug both the nostrils for 3 to 4 days in ENT hospital. You are asked to breathe through mouth for 3 4 days. So what is the point? You just treat it conservatively. It is not an emergency. If the person starts getting relief after 1 week, what is the problem? Person can breathe through mouth. So even this DNS also, and it recurs. DNS invariably there won't be permanent benefit from surgery. It's just temporary, and within months the people start getting nasal obstruction. So DNS also, this surgical intervention is not warranted at all.
Oh, thank you so much, sir. Namaste. Namaste, all.